My name is Dr. Timothy VanFleet, and my specialty is orthopedic surgery. My subspecialization is with spinal surgery. That's my fellowship training. My background was with the orthopedic surgery residency program in Springfield, but I do have a subspecialty fellowship in spinal surgery, which is my practice. Initially, I went into orthopedics. I was very interested in sports medicine. I have a background in a variety of different sports, and so like many jocks, I was interested in sports. I've always had an interest and a passion for medicine, and so the two were kind of a natural complement. But interestingly, as I went through my residency program, I became much more interested in spinal surgery, and that's when I decided to pursue my subspecialty training. The most challenging case are cases when patients will come in with a multitude of problems, back pain or leg pain, and trying to make them so that they're whole again. Those are very challenging cases to do. From a technical aspect, there's a whole host of challenges that I will constantly encounter in practice. But as far as the actual challenging cases, to bring the patient into the office, try to make them understand the problem that they actually have, and then make it so that we can actually make them much more functional. Those are challenging cases. Well, of course, my most rewarding case is when we're able to actually achieve that end result. So patients that will come in that for one reason or another are incapacitated, we're able to make it so that they're actually able to relive that quality of life that they were seeking to enjoy, that they'd missed out for so long. I'll have patients that will come into the office, and I see them on several different occasions for visits, and I don't know them other than the fact that they've always been in a wheelchair or sitting down. And after surgery, I'll have patients that come back and they're actually standing up and walking in, and I'll look at them almost to the point where I don't recognize them because I've never seen them walk in before, and it's just completely fulfilling. My passion for excellence is really in terms of seeing patients, being able to pursue the degree of technical training, being able to converse with the patients. My passion is to take the ability that I have, which are my technical skills, and apply that to treating my patients so that they're able to enjoy and relive that quality of life that they were seeking. My practice is specifically honed in on minimally invasive spinal surgery. I do a specific procedure called minimally invasive transforaminal lumbar on body fusion, which is a big term. MIS TLIF is what we call that. I've been doing that procedure for about 7 years now. I used to do traditional open spinal surgery, and I still occasionally will do that. But having compared the open surgical results on patients with my MIS TLIF, very minimally invasive results, there's no question about having done it both ways. I think this is a far superior way to do it. Minimally invasive spinal surgery is a procedure whereby we're using smaller incisions, shorter operative times, much lower infection rate, much quicker recuperative times. Patients are bouncing back. They're out of the hospital either same day or just overnight, and they're back to work and back to enjoying their activities much quicker than with traditional open surgery. That's been the focus of my practice, just because of the sheer fact that I think the procedures, minimally invasive, provide a superior operative and patient experience, both. We're a smaller group. We're focused on patient care, patient convenience, patient satisfaction. I think with larger groups, perhaps they kind of overlook that. We know that the patient, they want to seek out that perfect, satisfying experience, and so we want to be able to provide that. I would also say, just on behalf of myself personally, as well as my partners, I think we're all great surgeons. We're all very well trained, and we want to be able to provide that service to those patients. Certainly our patients that are here already, and patients that are looking for physicians. We're all board certified orthopedic surgeons. My passion for medicine is always pursuing excellence, trying to make it so that there's a perfect experience. Being a perfectionist sometimes is not always good mentally, and so from that standpoint it's always good to release And the way that I like to do that naturally is to try to keep myself in shape. I find that running and exercise is a great way to relieve myself sometimes of those stresses that oftentimes will occur as a result of being a perfectionist.